In the year 2011 alone, 10 patients were rushed to the hospital and were taken into an emergency ward. After a thorough checkup, it was revealed that all of them were suffering from some certain kind of liver injury. And you won't believe the reason they revealed. Turmeric. You know, that golden spice that's been hailed as a superfood and sprinkled into lattes, smoothies, and curries almost everywhere. Well, it turns out, it might not be all sunshine and rainbows. But first, let's get to know this golden spice a little better. What is turmeric? Turmeric, scientifically known as Curcuma longa, is a flowering plant of the ginger family. It is native to Southeast Asia and has been used for thousands of years in traditional medicine and cooking, particularly in Indian and Southeast Asian cuisines. The bright yellow-orange color of turmeric comes from curcumin, which is its main active ingredient. It is a staple in Indian cuisine, where it is used in everything from curries and soups to rice dishes and even desserts. It is also widely used in Middle Eastern and Southeast Asian cooking. Recently, turmeric has gained popularity worldwide thanks to its health benefits. You can find them in turmeric lattes, golden milk, supplements, and even skincare products. So why has turmeric become one of the most loved spices in the world of health? Let's discuss all of its benefits. Number 1. Anti-inflammatory properties. The main claim to fame for turmeric is its powerful anti-inflammatory properties, primarily due to curcumin. Chronic inflammation is linked to many common Western diseases, such as heart disease, cancer, and Alzheimer's. Number 2. Antioxidant effects. Curcumin is also a potent antioxidant that can neutralize free radicals and boost the activity of the body's own antioxidant enzymes. This helps in protecting the body, which is a key factor in aging and many diseases. Number 3. Improved brain functioning. Curcumin can increase brain levels of brain-derived neurotrophic factor, a type of growth hormone that functions in the brain. Many brain disorders have been linked to decreased levels of this neurotrophic factor, so curcumin's ability to boost these factors' levels could potentially delay or even reverse diseases and age-related decreases in brain function. Number 4. Heart and brain health. Turmeric may help improve the lining of the blood vessels, known as the endothelium. Endothelial dysfunction is a major driver of heart disease, as it involves the inability of the endothelium to regulate blood pressure, blood clotting, and various other factors. Number 5. Cancer prevention. There is some evidence that curcumin may prevent cancer from occurring in the first place, particularly cancers of the digestive system, like colorectal cancer. And lastly, digestive health and diabetes. Turmeric stimulates the production of bile, which helps digest fat. It is also known to soothe the digestive system and reduce symptoms of bloating and gas. Now, while turmeric sounds like a wonder spice, it is not for everyone. In fact, for some people, it can cause more harm than good. Like the patients that were reported earlier, some of them were allergic, and some of them had issues that stood in their way from consuming turmeric. Now, the main question that you might ask now is, what type of people are not allowed to consume turmeric? And why can't they consume the seemingly golden spice, beneficial for all? Let us explore why. Starting with our first category, which is pregnant women. Pregnant women should be cautious with turmeric. While small amounts of food are generally considered safe, taking turmeric supplements can stimulate the uterus or promote a menstrual period, which might risk their pregnancy. A study from the Journal of Obstetrics and Gynecology Canada highlights the potential risks of high doses of turmeric during pregnancy. Next are people with gastrointestinal issues. Turmeric can be harsh on the digestive system for some people. High doses of turmeric can lead to stomach upset, nausea, and diarrhea. Those with GERD or acid reflux might find that turmeric exacerbates their symptoms. A study from the American Journal of Gastroenterology noted that turmeric could aggravate symptoms of GERD in some individuals. Individuals with gallbladder problems are the next ones who should be careful. Turmeric stimulates the gallbladder to produce bile. For most people, this is beneficial. But for those with gallstones or bile duct obstruction, it can be problematic. It can cause severe pain or worsen the condition. A study in Digestive Diseases and Sciences found that curcumin supplementation could exacerbate gallbladder issues. Patients undergoing surgery should also be careful. Turmeric has blood-thinning properties, which can be problematic for individuals undergoing surgery. It can increase the risk of bleeding during and after surgery. It's recommended to stop turmeric supplementation at least 2 weeks before any surgical procedure. Research from Anesthesia and Analgesia Journal indicates that turmeric can affect platelet function and coagulation. People with diabetes. Turmeric can lower blood sugar levels, which is generally a good thing. However, for some people with diabetes who are on medication to lower their blood sugar, consuming any turmeric can cause hypoglycemia, a condition where the blood sugar of a person drops too low. A study in Journal of Endocrinology and Metabolism reported these effects in diabetic patients. People with iron deficiency. Turmeric can interfere with iron absorption. For people who are already iron deficient or prone to anemia, consuming large amounts of turmeric could potentially worsen their condition. Research in the American Journal of Clinical Nutrition suggests that curcumin may inhibit iron absorption in the gut. Allergic reactions. Some people might be allergic to turmeric. Allergic reactions can range from mild skin rashes to severe anaphylaxis. If you notice any allergic symptoms after consuming turmeric, it's best to stop and consult a healthcare professional. There are various other consequences to their bodies, such as our kidneys. Dr. Tom Bernanke discussed his opinions in one of his videos. About the patients that we discussed earlier, Dr. Jay Hufnagel discussed it in an interview. In an interview with Medical News Today, Jay Hufnagel, MD, one of the case study's authors and the head of the liver disease research branch in the NIDDK division of Digestive Diseases and Nutrition, which is in charge of the DILIN, stated, "The question we're already asked is, how come now? Suddenly you're seeing this?" And that's a very important question. Why? One reason is that it's being used by millions of people now. But the other reason is turmeric is a spice, right? It is not absorbed. You don't absorb pepper. Your body doesn't absorb it. You don't absorb curry, the spice turmeric. Okay, so how could this possibly cause liver disease if it's not absorbed? Well, the answer, we think, is that these modern products of turmeric have been altered so that they are absorbed, he said. The 10 individuals identified as having liver injury following turmeric supplementation carried a specific human leukocyte antigen allele known as HLA-B3501. Despite this normally existing in the population at a frequency of about 6 to 7%. These alleles are genes that encode proteins that aid the immune system in identifying cells as foreign substances or as components of the body. Hence, they are involved in either autoimmunity or immunity. According to Hufnagel, it was a mistake to classify turmeric supplements as safe as turmeric used in food, as most regulations since the 1970s have done. Although he acknowledged that turmeric has been used for hundreds of years in Indian medicine, he made clear that this use was mostly for digestive problems, and that consuming a whole gram of turmeric in a capsule every day is not the same as using a small amount of spice in a meal. It's a typical Western approach to traditional medicines. You try to find out what's the active principle, and then the more the better, right? The higher the dose, the better. Well, that's not true in biology. In biology, the correct dose is the correct dose. And if you go higher, all you have is more side effects, he explained. While turmeric can be a fantastic addition to your diet with its numerous health benefits, it's not a one-size-fits-all remedy. Always listen to your body and consult with healthcare professionals before making any significant changes to your diet, especially if you fall into any of the categories we discussed today. Knowing all of this information should provide you with an idea about how much you should and shouldn't consume turmeric. Turmeric is incredibly beneficial, but it can also be dangerous if consumed without proper consultation. Always check with your healthcare provider before adding turmeric supplements to your routine. Remember, prevention is better than cure. If you found this video helpful, don't forget to hit the like button, share it with your friends, and subscribe to our channel for more interesting insights. Stay healthy, stay curious, and see you next time. Thanks for watching.